Please welcome our Honorable Nagahaga, Governor Lumion Guerrero.
Half a day. As of this morning, 31 of Guam's 121 COVID positive cases have fully recovered and are with their families. While this number is positive, we must not stray from the strict path of social distancing. These recoveries would not have been possible without everyday heroes who risk their lives in the service of others. But they cannot win this fight alone. They need your help. To beat COVID-19, every single one of us needs to follow the social isolation directive. Everyone needs to stay home because failing to do so places yourself and those around you at risk. I recently announced the creation of the COVID response pay differential policy. The differential pay is proportional to the level of risk they face in exposure to COVID-19. Unclassified employees working in the office of the governor and the office of the lieutenant governor, agency directors, and deputy directors will be excluded from the differential pay policy, except if their assigned duties require risk of exposure. Though the dangers of COVID-19 are very real, I've been told that this is the first time since World War II that Guam's faithful will not be able to congregate in recognition of Easter Sunday. I also know that this special day is a time for family, friends, and celebration. This is a difficult request to make, but I urge the people of Guam to limit their interactions to people within your household. This isn't forever, just for now. And our current reality does not have to be longer than it needs to be if we take social distancing very seriously. Pending a vaccine, this is the only tool we have to effectively slow the transmission of the virus and bring our numbers down. COVID-19 has altered our daily lives in ways we could not even imagine in order to keep us and our community healthy and safe. We have a long road ahead of us, but we must remain hopeful. Every day since the beginning of this public health emergency, people on our island have gone out of their way to support our frontliners. While being safe, they have thought of innovative and creative ways to serve others. From time to time, I've recognized individuals, volunteer groups, organizations, and retailers that have taken small steps in our great struggle against COVID-19. In real life, heroes don't wear capes. Sometimes they wear scrubs, EMT uniforms, or are called mayors. Sometimes they run a small mom and pop shop and operate sinks for their customers. Today's COVID hero is Park Smart in Dedido. Buying essential items should not be an added risk, especially during these uncertain times. In them and those like them, we find the seed of our victory. I'd like to ask Linda now to, again, give us our status on the COVID-19 cases.
Thank you, Governor. Yesterday, we had a total of 36 cases. 8 were positive, 1 was a follow-up, 24 was negative, and 3 had to be rerun. The testing from March 12, 2020 to April 7, 2020, there were a total of 644 cases of testing. And of that, the negative numbers are 520 and 124 are positive. Now I'm going to give the breakdown of the 124 that are positive. 121 of these cases are now broken down, that we have 110 are local, 11 are U.S. Naval Hospital tests that are reported, and these are tests that are done at San Diego. And in addition to that, we have 1 case that was also confirmed by DLS. This is our commercial lab that we're using. And we have the 2 clinically diagnosed local cases. And so if you add all these figures together, they total to 124 COVID positive cases as of yesterday. The breakdown of these COVID cases, we have 64 at the northern region of the island, 41 at central region, 17 at the southern, 2 are homeless, and that gives us a total of 124. In regards to the age breakdown, from 0 to 9 years of age, we have 1 case, and that's a 1-year-old baby through a household contact. The 10 to 19 age group went up. Now we have 7. 5 are household contact. 1 is travel related to Honolulu, and 1 was from a birthday gathering at a hotel. The 20 to 29-year-old age group, we have 12 COVID cases. The 30 to 39-year age group, also 12. The 40 to 49 years of age, 23. 50 to 59 years of age, 23. 60 to 69 years of age, 32. 70 to 79 years of age, we have 9. 80 to 89 years of age, 4. And 90 and above years, 1. And that again totals to 124. As far as the gender, majority are females, 65 of them, and the males are 59. In regards to their medical status, 73 remain very stable. 16 are hospitalized as of yesterday. And at GMH, we have 7 in their inpatient unit. At the IC unit, we have 2, and at the SNF unit, 7. Happy to report that those that fully recovered, as the governor indicated earlier in her speech, 31. That means 4 more recovered today, so as of yesterday. And deaths, 4, and that gives a total of 124. So the breakdown of all our cases, we have 47 in home isolation, 26 are in the isolation of the government of Guam facility, and again, 7 are at SNU, as I mentioned earlier, 7 are at GMH inpatient unit, 2 are at ICU, 31 recovered, and 4 have died. In regards to the travel history, we find that 17 are with travel history, and of the 17 individuals that travel, 3 have traveled to multiple countries, with 65% of those traveling, majority of them, 65% are traveling from the Philippines. 107, however, have no travel history. And of this 107, the breakdown are as follows. We have 30 that have household contacts, 11 that have community contacts, 19 are healthcare contacts. And of that 19, the breakdown is 6 are healthcare contacts as a patient, and 13 are as a healthcare worker. And we have then 47 left that are not reporting. There's no reported contacts. Currently, our quarantine sites, we have 129 people still under quarantine as we speak, and they will remain in quarantine until their 14 days is up. As far as the travelers that have completed the 14-day quarantine, we still have 229. And so they will remain in place until, again, their time is up. In regards to those that are traveling and in isolation, and that means those are the combination of those who are COVID positive and they're doing their isolation in our isolation government of Guam facility, we have 26 at this time. Those that have fully recovered, 31, as I mentioned earlier, and so did the governor. And the age breakdown is we have none of them between the age group of 0 to 19. We have 4 of them between the age groups of 20 to 29 years of age. Those that are 30 to 39, we have 5 that fully recovered. 40 to 49 years of age, 7. 50 to 59 years of age, 6. 60 to 69 years, 6. 70 to 79 years of age, 1. 80 to 89 years of age, 1. And 90 and above, 1. The data, as far as the 31 that have recovered, majority female, 16 of them, male, 15. In regards to the region, northern region, 6 of them, central region, 15, and southern, 10. And again, in regards to the travel history of those that fully recovered, 8 traveled for 14 days before the onset of their infection, and 16 have no travel history, and 7 are yet to be determined. Thank you, Governor.
Thank you, Linda. I'm open for questions now.
KUAM, Nestor Lacanto.
Good afternoon, Governor.
Good afternoon, Nestor.
I wanted to ask you, there was a bill that was introduced by Senator Lee and 7 other Democrats and Will Castro, Republican. It calls for direct payments to taxpayers of $400 for individuals and $800 for joint filers. Basically, I think it directs you to come up with $15 million wherever you can find it within your general fund fiscal year 2020 appropriations or special fund appropriations, and transfer that to rev and tax so they can cut those checks. I was wondering if you could comment on that.
This is similar to, I think, what the federal government is trying to do in terms of our recovery rebate. And if I'm going to fine $15 million, that's not enough, because my estimates in terms of the one-time tax rebate is anywhere from $130 million to as high, I think it's $150 million. So 15 million isn't going to provide for everyone. I think what we need to do is, again, work with the federal program. And I know Daphne, our Director of Department of Revenue and Tax, is working very closely, like I have said. She's getting the details almost completed. Again, she just needs approval for implementation plan. We're actually, Nestor, in the scheme of everything in the United States, we're actually the very first area that had submitted our implementation plan, and I know that we are priority up there. And I'm hoping that within the next 2 weeks, 3 weeks, we'll be able to do that. Now, what I am also looking at is how can we advance payment, if we can, in terms of the tax rebate, the recovery rebate. And so I'm talking to Daphne and Ricky and other people to see if that's something that is possible to do.
To follow up on that, where would that money come from then? Where are you looking at? What source?
Which one?
For the advance payments on the federal funding?
We would be probably looking at payments back to us from the federal government, from U.S. Treasury, on the war reparations.
Okay, so the war claims fund. So let me get this correct.
So
the Treasury would the Treasury would advance you the funds, and then when it's time to pay individual adjudicated war claims, they just write themselves a check, kind of like
no.
Like
so what if you remember our local war reparations program?
Oh,
what we did was we advanced our Manamtu. We advanced them their war reparations claims, and what they did was they assigned their claims that have already been adjudicated through the U.S. Treasury, or not the Treasury, I think it's the War Claims Commission that had adjudicated these claims, and so we advanced the payments. What they did was they said, yes, Government of Guam, I am assigning you my claims, so pay me the money through your local fund. And then what we did, we've been communicating very closely with the U.S. Treasuries. We were sending them a list. They were verifying, they were reconciling, so they have all that information now. So when 1365 passed, the Treasury then took over the program, took the program back, because now they can access the Section 30 monies. Remember those Section 30 monies that were put in a fund? They can access that money. That's close to about maybe 23 million, 24 million.
Right.
So what now we are doing is we are saying to the U.S. Treasury, okay, pay us back that money now that we have advanced. So they are now taking money from Section 30 and paying us back. So some of that money, we are going to be, we are looking at seeing how we can advance the recovery rebate till we can get again the recovery rebate program from the federal government to pay us back. So what we're doing really is we're moving funds around, as you can see, in a very maybe complicated way, but we are moving funds around so we can then provide our individuals out there with the much needed program. I mean, much needed assistance and benefits. So the other thing, Nestor, that can immediately also work is if the small businesses would apply for the paid protection loan, because then if they apply for that, they can rehire these people that have been unemployed. They can rehire them, pay them their paychecks out of the loan that they have gotten, and then the federal government will forgive those loans, that portion of the loan that is used to pay for payroll.
Yeah, I understand that there are a lot of companies that are actually applying for that. I think
yes, they are, and I know financial institutions are already accepting, and I think it's just a matter of funding them, and they're working out with the federal government because that's almost a direct grant to the small businesses to continue hiring these employees. And so that's another way of funneling cash to the employees.
Okay, Governor, just so I'm clear, so the pot of money that you're looking at in terms of the war reparations money, that's money that was the Section 30 money that was in excess of that certain level. I forget what it was. That's the money you're talking about, right? Okay.
Right. So if you remember the war, I know it's been a while. It seems like years, but if you remember the war reparations, right? It was passed in the both House and the Senate and was signed, and the law there was that anything above 68 million of Section 30 money was to be put in this fund. I think it's called the War Reparations Fund. In the federal level. And so they would take about 11 million one year, 13 million the next year. So in the past 2 fiscal years, they have already put in about $24 million. So theoretically, what was going to happen was that money in the fund was supposed to be used to pay the claimants their adjudicated claim. However, we wanted to advance them, so we said we will use our local monies to advance them. But once 1365 is passed, which would then allow U.S. Treasury to access that fund, they would then pay us back for that advancement.
Thank you, Nestor.
Is it clear, Lester?
Guam Daily Post, John O'Connor.
Hello, can you hear me, Governor?
John, yes, I can hear you.
Okay, thank you, Governor. With the legislature gearing up for session, it appears you'll be getting the authority you need to enact or to implement additional restrictions. Can you provide details on the implementation of any penalties, as well as the implementation of the checkpoints and the adult curfew that we want to implement? How will the curfew affect people and businesses that are open later than, say, 6 p.m., as well as individuals working in the media?
Right. So Once I get that authority, the implementation would be that we would announce that the curfew hours, and it doesn't have to be 6 p.m. We could make it 10 p.m. to, 6 a.m. That's something that we'll have to look at. And so we would just, through probably executive order, we would implement that. And then whatever penalties and fines that are attached to the mandate or to the law, there would be probably citations made by the law enforcement agency.
That's going to affect people. Will that also affect people who are, say, I don't know, barbecuing on their own properties?
For curfews, no, it would be that they just can't be outside. I mean, they can't go out. They can't be traveling.
The
If
citations.
if they're at home, that's good. I'm glad they're barbecuing at home and not at the beaches. So that's a good thing. It will not affect them. But if you are out on say the park, first, you can't be at the park. That's another violation. And if you're at the park after, say, 10 o'clock, if that is the curfew time, and please don't say that I said that's the curfew time. I'm just saying if that's the curfew time, then of course they would be given a citation.
So businesses will have to close earlier in accordance with the curfew?
What businesses are you talking about, for example?
Potentially grocery stores
I think grocery
let's say the
stores
curfew.
now close. I think they close around 10. Yeah.
Assuming the curfew is earlier than 10.
No, we would have to match it up to what's the activity out there that the adults have to be at.
Okay. And for the second question, regarding the advance payment, the plan you described sounds a little bit like what some of the bills are trying to do. And as far as I know, I thought that the federal reimbursements for the war claims would be subject to legislative appropriation.
So we're not calling it reimbursements, John. We're calling it payment back to what we used at the general fund. So that's a little bit of maybe a legal discussion, but the monies that we would be getting from the U.S. Treasury would be monies that they are giving to us to pay back the general fund, which we have used to pay the war reparations.
Thank you, John. Pacific Island Times, Johanna Suleiman.
Half a day, Governor.
Hi, Johanna.
Hi. So I'm gonna ask about the students that were supposed to graduate class of 2020. So all the money that they fundraised for their graduations and their field trips and their class shirts, what's gonna happen to those monies?
That's up to the schools themselves, right? That has no government oversight. That's not within my authority. Whatever the policies are of the schools, that's up to them. I mean, some may want to donate it to a charitable organization, but I think that remains under the purview of the related school.
Okay, thank you. And my next question is for Linda DeNorsi.
Linda.
Yes.
Hi. So, related to the Iglesia Ni Cristo, that church, they actually take attendance every time they show up for service. So, was the public health able to access their attendance list?
Yes, we were able to access the attendance list. We gathered about 300 people that were on that attendance list. We're only pending one more, which is the Manila listing. And once we get that, we have the full-blown list. Is there any other questions?
So you were able to contact everyone on that list?
That's what we're doing. That's our job. And so we are on it already. And we already identified 11 positive COVID patients affiliated with that church. And we're doing all the investigation. Our team is doing that as we speak. I just met with them yesterday and also this morning. And we're going to contact all of them. Yes.
Thank you, Johanna. Pacific Daily News, Steve Luciaco.
Yes, hi, Governor.
Hi, Steve. Good afternoon.
Afternoon. Um, so does Guam currently have the tents, beds, and other supplies and equipment it would need to create the alternative medical
Sure.
facility that we would need if, if there's a crush of
Yeah. So right now, as you can see, the trajectory that my medical advisory group was using was really trajectory of hospital facilities and, trajectory of hospital admissions, hospital patients, right? Because that's what you're tracking. You're tracking the volume that we will be seeing in these healthcare facilities. So right now we're tracking, and Lillian can give you more information, but I think we're like 17 patients now. And so we're still really way below where that break point is that would overwhelm the hospital facilities. So to your question about how are we preparing, we're definitely preparing. We are already going to be purchasing 20 of those Blue Met, which is like a dome tent, and it can house 10 patients, and it's aircon. So Dr. Luis Cruz is in charge of that project, and he's been giving us updates. So in the inventory that we're looking, we were able to come up with about 1,020 potential expanded beds. We have now 40 ventilators, and we have already, if it's not already on island, 35 more ventilators. As you know, ventilators is one of the equipment that's necessary to manage respiratory distress, and people do recover by the help of the ventilators. So we're very concerned about the number of the ventilators. I think we'll be able to work out with these numbers of ventilators. The other thing that we are also looking at, of course, is any kind of field medical stations. And we're looking at several places that would qualify. NAFAC and NAFAC and Public Health have been going around assessing places that would be very appropriate and adequate for these extended beds that we want. Our concern is the medical personnel. And, we could have all the facilities we can. That's not an issue. It's really the medical personnel. So one of the things that I'm working out with Admiral Manoni is he is bringing in medical personnel for the managing of the Theodore Roosevelt situation. And he has said to me that those medical personnel would also be able to help the civilian community if we need the help. They will be there to help us with if we get to that point where we need more medical personnel. Right now, we seem to be okay. And if we continue on with a census of 17 COVID cases, 18 COVID cases, we would be okay with the hospital capacity. But given all this, again, the best tool, Steve, out there, I know you're going to be tired of me saying this, is if the community would just stay in, do social distancing, don't minimize your social contact, don't be out there if you don't need to be out there. That's what's going to get us through this coronavirus situation. That's what's going to get us to be able to continue our current hospital capacity to treat our patients. And that's the tool. That's the key. That's the driver in providing quality of care. Because if you do have those resources, people will survive from this disease, from this virus. There will be fatalities because of, those people that are immune suppressed or they have comorbidities, meaning they have diabetes, hypertension, kidney issues, whatever. They're already at a not so healthy state. And if you get infected with the virus, that could just get you over. So I think, Lillian, do you want to add anything to this? Yeah. Right now, yeah, you might want to say what our census is now at the hospital. So let me have Lillian add on to it.
Thanks.
Thank you, Governor. Yes, as Governor has mentioned, our census has been going through, ranging 16, 17, 18, but cumulatively, a total of 26 COVID positive individuals we treated at the hospital. Of those 26, 16 was discharged with release to the COVID facility, our government facility, not at SNF, but beyond SNF, and some of them have gone home. So, again, as the governor mentioned, that given the number of individuals that need hospitalization, it's manageable, but we are preparing as it is projected in the trajectory model that Dr. Cabrera presented. We are preparing, for the influx, for the surge of adult individuals who need to be hospitalized. Thank you.
Steve, your follow-up question?
Oh, yeah, sure. So Governor, I had a question about the restrictions on what essential businesses can sell.
Okay.
Is that a final sort of policy, or is that going to be adjusted in any way? Because at some point people are going to need to buy clothes, kitchen utensils. Students who are learning online might need school supplies or art supplies, even depending on what class they're taking. So what are your thoughts on that?
So the essentials, are like food, medicine, any kinds of cleaning, house cleaning, essentials, to clean your area, because it's very important that we do that. And by the way, the COVID virus does respond to alcohol, bleach, Lysol, and so forth. And also if, things like house maintenance stuff. So like I always say, if your plumbing goes bad, you'll be able to go to Home Depot and buy whatever plumbing materials you need. The biggest reason for that, Steve, is that we want to minimize any kind of increased social contact as a result of meandering and staying longer in the grocery stores or in those retail businesses that are open. So basically, right now the directive is only those essential items are to be allowed to be purchased in those stores.
Okay, thank you,
I
Governor.
hope that we don't have this COVID virus so long that people need to replace their clothes. Linda has more information that she can also add.
Yes, we're gonna be releasing today the guidance as far as what's essential and non-essential. And to answer your question, the non-essential retail stores mean stores that sell non-essential items, as the governor had indicated. And these are not just limited to stuff like clothing, shoe stores, furniture stores, jewelry stores, kiosks, novelty shops, and sporting goods stores, vape shops, video stores, and rentals. And again, that release will be out. I just got through signing it, and it'll be out by today through the Joint Information Center. And that will itemize everything that you want to know as far as what is an approved business operation activity. It's very detailed, and I have it right in front of me, but I'll be here till tomorrow to give you all that detail. So please look out for it. And it is in the amendment that we issued out. It will be under the Executive Orders 2020-04, and this is relative to the 05, 06, 07, and 09. And this is the guidance that will come out from our Department of Public Health, and I've already signed it. Thank you.
from the 20th.
Half a day, Governor.
Have a day, Oya.
Ma'am, just a quick question. With respect to public assistance, I know you've been urging people to apply, and it makes sense in the sense that it's a program that already exists. We are getting questions, though, from a lot of readers about getting the essential documents. For example, getting the information, the verifications from schools, the verifications from mayor's offices. Can you speak to how folks are, or what you guys are doing to help folks get through these processes and get the necessary documents in order to apply for public welfare, for Medicaid, MIP, and food stamps?
Yeah, I think one of the things, if you go to the 311 and they refer you to the public service, they'll let you know ahead of time what kinds of documents you need to verify. And Linda's here. She could probably add more to it because public welfare is also under her oversight and responsibility. But I think if people are prepared with those documents a little bit ahead of time, they could probably have their applications expedited.
Yes, thank you, Governor. Yes, we have contact numbers, and we've added, as the governor indicated, to the 311. They'll call that number, and then they'll be connected to option 2, which will be for public welfare inquiries. And I'll just give you that number so you can help us to circulate it all around town. It's 735-7237, and that's with the Bureau of Healthcare Financing Administration at the Castle Mall. And we also have 735-7575 or 7576. Which will be the Bureau of Economic, also the Castle Mall, and the Economic Securities is for the SNAP program. And then we also have the Bureau of Economic Securities for the Northern region, which is 735-7488. And again, this SNAP program for the Bureau of Economic Securities at the Southern, you call this number 735-7542. Now, in regards to this, I've already asked Tess Archangel to be very creative with all my staff, so that we don't have them all lining up and crowding the whole public health. What we're doing is we're putting drop boxes. So whatever essential information as far as documents that they're going to need, they'll just drop it in the respective drop box. They can also email it, and they can also send it through the mail, the regular mail. Email's a lot faster, as you know. And so our staff will gather all this information, and whatever is missing, again, if you gather all the information that we need, we can process it in one day. And I was assured by my staff that that can be done. However, if you don't have the proper documents, we're also working with the mayor's offices, and they're going to help us as well so that we don't have everybody crowding everywhere. So the mayors can also, we're trying to get them to also accept all these documents, and then we can move these documents to our department. And that would expedite a lot of things. Right now, the biggest challenge that we're facing, and we're working on it, is that we're trying to get a list from the businesses that either closed down or they're furloughed their employees, to get the total number of employees that are on that list of those that have been furloughed or they're not working. And if we can verify that, then that will help us with the application process. Our staff are also in close communication with the Off-Island Food Nutrition Services Program, so we can see, is there any other creativity that we can allow? For example, just have a temporary period of when they can be under the SNAP program. And we're just waiting for that clearance. And if we can get that clearance done, if they can say, okay, we'll cover to a certain period, then we'll right away process those and let them be available for those who are new applicants, and so they can be eligible for the SNAP program. Thank you.
Okay, so you are working with mayor's offices and, for example, Department of Education, which requires, because one of the required documents, if I'm reading this right, is getting, for example, the verification of enrollment for your children so that you can count the family size. But you are
Yes.
working with those various agencies to ensure that
That's
they're
correct.
able to provide these documents for people.
Yes. Yes,
Okay.
that's absolutely right. And we're a better way to know where you're living and your household size is mayor's office. So we're putting everything together to make sure that we can get that information, and it'd be a lot easier for all those people. And so that's what we are putting together, our staff with the mayors. Okay. Thank
Yes,
you.
ma'am. My second question, oh, sorry. For the governor?
Yes.
Hi, Ganga. So can you clarify, ma'am, with respect to rentals, can landlords continue to collect rent? And what are the parameters for the eviction protections for people the people who are renting, the renters?
Well, there, in our executive order, we did say that there will be no evictions, and that's basically it. People cannot be evicted if they cannot pay their rent, and the landlord can continue collecting the rent, but if they cannot pay their rent, they cannot evict those individuals.
Thank you, Oya. Mariana's Business Journal, Maureen Marquita.
Buenas, Governor.
Buenas, Maureen.
So I just wanted to clarify two things in connection with the implementation plan that you talked about that would take funding from potential or actual Section 30 money. So the first clarification of that question is, would that be electronic payments? And the second part is of that clarification for that question is, would it be the full amount that the federal government is intending to give people as a direct payment, or would it be a partial amount?
So are you asking how the federal government will give the payment to the government of Guam? Is that your question?
No, I'm assuming that you will have it to disperse. I'm asking whether it would be dispersed electronically and whether it would be the full amount.
You mean to the individuals?
Yes, or to the couple if it's a couple payment.
Oh, for the advance payment.
Yes.
We would probably, I think the best way that Daphne was looking at was if we could do direct payments into their accounts. And I think they're trying to see if they have accounts with these people or not. If not, then we would have to then print checks, and we would have to mail them to the individuals.
Okay, and would it be for the full amount?
It would be whatever amount that the federal government that we are looking at with the federal government. So it would be like the 1,200, the 2,400, and so forth.
Okay. So my second question was about citations that may come in from Thursday or from Friday, whenever it is. So you said a few days ago that you thought a fine of 5,000 was a lot. So does that authority that the legislature is going to give you allow you to determine the amount, or do you have to ask the legislature to reduce it if you want it reduced?
That is under the strict authority of the legislature to decide what fines and fees, the amount of the fines and the fees that they would put into the mandate, into the statute. So right now, the legislature is looking at 5,000. That was not an amount that I asked them to do. I never even spoke an amount of, we never discussed, or I never requested any amount as to the fines or the fees. That's the legislature's role and responsibility.
Thank you, Maureen. I-94, Chris Barnett.
For today, Governor,
Go ahead, Chris.
I just wanted to ask, as a result of the economic impact of COVID-19 and the CNMI, we saw their governor plan to reduce the current budget by almost half, 48%, terminating accepted service employees, except those that are in federally funded positions or expressly exempted by the governor, and furloughing civil service employees for a 1-year period to reduce government personnel costs by 50%. We tried to get Senator Joseph Augustine, but I think maybe he's in self-isolation because no one's heard from him. So just on this question here, do you foresee yourself doing something familiar on Guam? And what cost-cutting measures do you plan to implement as we're, I feel like we're barreling towards payless payday. So what are we going to do about that?
So right now, I am not planning any furloughs for our government employees. And that's a balance that's a decision that needs to be balanced out, Chris, because if I do furlough them, they'll be out there needing also public assistance, needing also food stamps and so forth. So right now with our financials that we're looking at, we are still able to make payroll. And I'm trying as best as I can to keep the employees employed, because that's, I think, the most balanced and prudent way to deal with this economic. If I can continue paying our employees, I will continue paying our employees. If I can continue keeping them employed, I will continue keeping them employed. There is also, the CARES. At the CARES Act, there is also a economic relief amount that's given to the states and the territories, and the amount that they will be giving to us is about $112 million. So if I can work it so we can shift payment of these payrolls, that would be the route that I would also look at. So for me, the best thing for our economy is to try and keep employees employed so they can have the money to go out there and buy their food, their medicines, gas their cars, still put in back into the economy.
Thank you, Governor. My second question, I wanted to talk about the Department of Corrections. We interviewed Major Anton Uggan this morning, and he had said that the prison was passing out cleaning materials. But, we have a letter here from the wife of an inmate, and she's saying Major Uggan lied when he said they were passing out cleaning materials. Inmates don't even have toilet tissue, let alone cleaning supplies or other hygienic products like hand sanitizer and masks. The department has canceled all incoming, which is the only way we receive any hygienic products, among other things that we're allowed from our families. The guards have to provide their own masks and gloves. Most didn't even wear any until today. Something needs to be done to help us. We're still humans after all. So I guess my question would be, how concerned are we about an outbreak at the Department of Corrections, and how confident are you in the leadership?
I am very concerned about any outbreaks, whether it's at the Department of Corrections or the bingo or the Iglesia de Cristo. Of course, I am concerned. And I trust that my acting director, Joe Carbolito, is on top of it. I will talk to him about making sure, I'm pretty sure, Chris, that they do have the PPEs, because we are very concerned that all the law enforcement people, all those people with direct contacts with face-to-face with people, is given the necessary required PPEs to protect themselves and to do their jobs. And as far as the inmates, I trust that Joe Carbolito and Bob Camacho are up there providing for the safety and the health and the hygienic environment for our inmates. So I will follow up with them, but I trust that they're doing what they need to do to keep also the inmates and their employees safe and minimize exposure and risk.
Thank you, Chris. Lastly, Kevin Kerrigan.
Good afternoon, Governor.
Good afternoon, Kevin.
I have an economic question. S&P today revised its outlook on various government bonds to negative as a result of the damage being done by the coronavirus outbreak. Wondering if you can share your administration's thoughts on what, if any, long-term damage this pandemic is having on our economy, and most importantly, how long may it take for us to recover from all of this?
All right. So that's a discussion that we also have within our National Governors Association. And, you know, look at our stock market and look at the marketable securities. They're not doing any good. And so it has of course, a very negative impact on our economy. Here specifically, we have no tourists. Our tourism industry, I would say, is below zero. Predictions are that we would have a negative tourist arrival of close to about 700,000. So yes, Kevin, it is dire straits for our economy. That is why, and it's not just isolated to us, it's throughout the whole global world. Everywhere, Asia, Europe, and the United States, and so governors are really pressuring the president to distribute all those federal help so we can start recovering from this pandemic economic impact. And so that's also why, if you look, Congress is putting out $2 trillion worth of packages of financial help to all the United States and the territories, and also the I think they're also giving to FSM and the island nations. And there's even a fourth package that they're looking at, Kevin, which is structured primarily in putting more money into infrastructure so that when we start recovering, we can start hiring more people to work in infrastructure projects. We're already putting together a shovel-ready infrastructure package to give to Congress or to give to the federal government so that we can get the monies also for infrastructure so we can put people back to work. There's estimation, Kevin, that it will take anywhere from 1 to 2 years to totally recover from this pandemic situation. So S&P, I think S&P is doing the same thing to everybody, a negative outlook for everybody. I'd be very surprised if their credit is not changed to negative outlook.
I'm sure you're right about that, Governor. That's all the questions I have. Everybody else answered my other questions. Thank you.
Okay, thanks, Kevin.
Now for closing remarks from the governor.
Yes. Thank you again for this opportunity to present to you. And if you have any more questions and details that need to be answered, please do not hesitate to also call my office. I'd be more than happy to speak to you about what your questions might be, or to the 311 numbers so that they can also give you information and details and instructions on what to do, what to follow. And again, I just want to be assuring our community that we are doing everything we can to promote the economic health and our people's health also as the priority. We need to really focus and all our energies into the health of our community. And I wanted to stay in the lower end of our trajectory and to flatten the curve. And again, I'm going to say it again, stay home, do social distancing, wear your mask, and I know we're a loving community, but hold back your kisses, throw